So
Okay.
and
So
the
then-
webinar is being recorded. Okay.
It does work. Okay.
The participants, I see 8 participants. Where is that list? Why don't I see that list? Here we go.
Under panelists.
And I see Donna Raftery and Gina Meehan. I don't know if I'm pronouncing that right. And 8 panelists. I do not yet see any of our guests.
Okay.
So we're going to wait a while. Anyone who is watching this at this point, we're going to give people a chance to come on. And then we will begin with introductions and an explanation of what this meeting is. Because it's really good to have our guests before we start. Let me see, I'm just gonna email them, make sure that they're cool. I tend to be. Let me just send them an email. I'll see. Night CB2 meeting. Okay, getting into Zoom. Text me otherwise. 72461. All right. Let's see if anyone else has shown up. No. We'll give everyone a few more minutes. Especially because our guests from the door are not on yet. And let me make sure no one is sending me. Okay, I don't have anything. Let's see. Okay, let's see if let me just. Sorry, I'm just going to try to text Ted Kane, who is the chief of staff, and make sure that their tardiness is just because they're in the middle of something and not because they can't get in. Hi there, Susan. CB2.
I don't have anything in my email that suggests otherwise.
To get onto the Zoom meeting. We are gathering now. Kelsey is running late due to a previous meeting running over. He should be able to log in by 6:50. Oh, gosh. Okay, well, that's a problem. All right, we're going to start this meeting and we will find some other way to spend the time for 15 minutes. Thank you everyone who is here, which is mostly our committee and a few attendees. Thank you for joining us. This is the January meeting of Manhattan Community Board 2's Committee on Human Services. We will start, the agenda tonight is to talk with The Door. The Door is an important social service provider in our district. We mention them every year in our statement of needs. And so we feel it's important to check in with them to understand their activities, their needs, anything we should be advocating for them, anything they might need from us. We're going to be hosting Kelsey Louie, who is their president, who is running late. So he is not going to join us until for another 14 minutes. So we're going to just start with introductions, and then we'll find a way of something else to discuss that I would actually be interested in discussing with our committee. So I will start. I am Susanna Aaron. I am the chair of the committee. I'm going to just call on people as I see the boxes. John DeBerna.
I'm John, member.
Ryder.
Hi, everyone. I'm Ryder Kessler. I'm a committee member and CB2 member.
Ivy. You're muted. Now you're not. Should be able to hear you. Anyway, I'm not able to hear you, though I see you very well. Now you're muted. All right. I'm just going to introduce you, Ivy. Ivy, the attractive woman with glasses and a black shirt, is Ivy Kwan Arce, and she is on our committee. Wayne.
Hello, I'm Wayne Quadler, community board member and committee member.
Will, I know, is in travel, so he was hoping to just be able to join by phone. Let's see if I see he's on the call. There you are.
If you can hear me, hi, it's Will, CB2 and community member.
We can
Committee member. Great.
We can hear you well, and thanks for joining in, even though I know you're in transit. A couple of people who are not in our committee that I'd like to introduce. Janine. Well, she's muted. Do you want to unmute yourself or?
Good evening. I'm Janine Kiley, CB2 chair. Welcome, everyone.
And I'll start with Mark Diller.
Hi, everyone. I'm Mark Diller. I'm the district manager for Community Board 2.
Brand new, and we are thrilled to have him. No one is more thrilled than Janine Kiley. Donna Raftery.
Hi, I'm Donna Raftery. I'm a Community Board 2 member.
And one of the chairs of our SLA committee. And Carter.
Hi guys, nice to see everybody tonight. Rainy night.
Carter is a member of CB2 and a former chair. And I'm sorry, Rachel, I forgot you.
That's okay. I'm a public member of the Human Services Committee. Thank you.
Okay. Thank you guys all for being here. We have a few outside attendees. And we've been warned that our representative from the door is not going to be able to join us for about another 10 minutes or so. So I'm going to just take a stab at raising an issue. Well, actually, I'm just trying to think of how to kill 10 minutes. So I would throw out a couple of questions, which I always like to do, which is there any topic? This committee is primarily self-initiated. There are very few times when we are asked to entertain a specific topic because the city is asking something from us. So, so I suppose a question I'd like to ask anyone who's here is there any subject that you guys would like us to take on? Remembering that we are a community board and we're not a state entity, we're just a community board. Anyone want to raise a hand? Okay, Ryder, you want to shoot?
I'm always happy to take up some space and time. I'm curious if the committee thinks it would be worth our talking about overdose prevention sites, safe injection sites. I think it's along the same lines of things we've talked about before around safe havens and places in various communities around the city that are providing services to folks in need that sometimes get community pushback, but which are potentially important infrastructure for quality of life. I don't know that there's any consideration of any of these kinds of sites in our community district, but it could be something worth talking about, and then maybe we would want to advocate for having such sites in our community district. So that's the first thing that comes to mind.
I like that. I also think what's interesting about that, I mean, and everyone else, anyone is welcome to chime in, just please raise your hand. What I like about that is that harm reduction is a model that is met with great skepticism, understandable. Housing Works runs a shelter in CB3 that operates on a harm reduction model. And as we know, there are 2 sites in Uptown Manhattan that are harm reduction injection centers. So even though it's not on our front burner, it's certainly an interesting topic that I think could shed light on other issues as they come up. I want to also open this to any attendees. If you'd like to raise your hands and offer a thought that you might find interesting for our committee. Carter?
Yeah, something that we have not revisited are all the diversion programs that we heard about in Washington Square Park from the district attorney's office, whatever else there may be. And it may be very interesting to everybody here to hear more about those in sort of an organized fashion, not necessarily connected to other issues, to better understand, how the city is helping people to get on another path. And I think that this might help people better understand some of the bail reform initiatives as well, and put it in a different context than how we usually hear it, and might be a little bit more clear to everybody. I was just surprised at how many there were in different initiatives that we heard about before COVID that don't seem to be publicized, and I'm not sure if our new district attorney has initiated even more programs, or whatever it may be.
That's an interesting thing that you raise, and it actually reminds me of a couple of things I should mention. We have talked often about when COVID started dissipating and Washington Square Park came alive, and there were a lot of complaints, quality of life complaints. Gail Brewer, who was the Manhattan Borough president at the time, organized a consortium, an informal consortium of social service providers, and asked them all to do outreach in the park. And her hope was to create like a carpet of social service outreach in the park at all time, whether it was for substance treatment or homelessness or whatever. It was sort of run by Greenwich House, but there was really practically no funding given to it. And so while one of the goals of it was to collect data to see if it was even an effective model to address quality of life concerns, it really just was not big enough to do that. So that's something that is very much in my thoughts, and especially in terms of mental health. And I've actually had a conversation with someone from an organization called Cases, which is an alternative, a diversion program. And I'm going to actually be talking with committee members at CBs 4 and 5 to see if there's a way that community boards can begin to address the mental health services for people in dire need. So thank you for that.
Yeah, just specifically, if somebody is engaged with the legal system, that's what I'm really interested in, because I don't think there's enough knowledge about that. Not necessarily the separate private engagement that happens, but I'm just really interested, because I'd like to make sure we can press the local precincts to make sure that that's happening too, for any of those resources, because I feel that we have a little bit more push on law enforcement engaging with people who maybe need other help, and I just think it'd be good to hear about that under that framework earlier. And it's very specific, but I think it would help all of us better understand the engagements. And we have had a lot of our board members over the last number of years have expressed a lot of concern about those law enforcement engagements. That's why I'm just very specific about that.
Okay, thank you. That's great. I'm going to go to some members of our committee who have their hands up. Ivy, I don't know if you can manage the muting thing. I know you've been struggling with it. You are still muted. If you'd like to type something into the, oh, no, if you'd like to tap something into the chat, give me a thumbs up and I'll read it. I'm gonna, while you try to figure that out, I'll go to John DeVerna. John, you can, oh no, you are unmuted. Why don't you, was your hand up, John?
It was. No, I just, I love that we're opening it up to conversations we want to have. I just don't want to make it that positions we're going to have. Ryder's mentioned about like safe injection, I think would be quite polarizing and something that might not be so well received by every committee member or the board writ large. But maybe it's worth discussing. But I think also a concern that I've heard from neighbors is the smell of marijuana that's proliferating throughout the streets. And while people are allowed, to, I guess smoke wherever you're allowed to smoke cigarettes, I don't think it's received in the same way, or maybe it's just as bothersome. I don't know. But maybe if there would be an advocacy or like a encouragement to try to be respectful of others as we're smoking in public, maybe more of a who was the San Francisco congressman who built his career on having people just pick up the poop. It's kind of that same idea. Keep New York clean and not so bothersome.
At every hour of the day, people on their way to work. I'm like, how is it possible that you guys? But one thing that you mentioned, John, is that the question of advocacy. Yes, of course, we're not going to entertain any subject with an a priori position on supporting or not supporting. Our interest is always to hear what people have to say, and in most attempts at solutions, there tend to be pluses and minuses about it, right? There tend to be side effects. And I think that our role is to try to hear all of those and weed through those. But those are both good ideas. Was there something else you wanted to say?
Yeah, I mean, I don't know if this is the right spot or maybe another committee. I know it came up a little bit in the last big board about outdoor dining. And maybe this is the opportunity now to try to figure out where we can have that conversation about what our position will ultimately be. Just strictly personally, I like it. I just think it can be improved. And I don't know where that conversation's happening.
It is not a purview. It's not in the scope of our committee, but it's certainly Valerie La Rosa has been spending a lot of time on it in the reopening working group. And so, and it has been a hot topic for CB2. I'm glad you like it. I have my feelings are much more mixed. I see Ivy is still muted, so I'm going to go to Rachel. Oh, you wanted in the chat. Wait, hold on, Rachel, 1 second.
Yeah.
Ivy might have said something in the chat. No, you have not.
I think I have the mute.
Oh, there you are. There you are. There you are. Good. Ivy, I can hear you. So let's do Ivy first, and then we'll go to Rachel.
Yeah, sorry, the phone thing is crazy. I just want to bring up maybe just a conversation whether we can two aspects. The mayor is suddenly feeling like he needs to have more federal money to help the immigration situation moving forward. So I think we should discuss that part of our legacy recently dealing with the community. And in that, I wanted to bring up maybe a practice of inviting people back to of the community that at the beginning where we were dealing with the housing work situation, that the difficulties of understanding harm reduction and being part of it. I think when we have like a situation like that, and after it went away by a decision, that we should try to engage the community in coming back to invite them to, so we can have a continued discussion moving forward, because these things are not going to change if we just think that one issue was voted on and there's the moving forward is a disconnect.
What
so basically I'm saying is,
yeah, I think that's a great idea. What I hear you saying is that since harm reduction was such a hot topic in context of the 231 Grant Street proposal when it was going to be a housing works shelter, now that it's not on the front burner, this might be a good time to open it up again, to have it again as a discussion when people aren't all hot and bothered and very nervous about it. So yeah. Thank you for that. That's a great idea.
Right, thank you.
Rachel?
Yeah, hi, thanks. I'd like to follow up on the harm reduction. I think it would be interesting to look at that. What's going on with it now? I think Brian Lair had it on either today or yesterday, and they spoke about it. I think given that the drug situation has changed considerably in the last, say, 5 years with the addition of fentanyl and tranq, we are seeing a different scenario, and it might be might be time to revisit it and look at harm reduction. I also wanted to say that Mayor Adams has put in this involuntary hospitalization for mentally ill people on the street, which I think follows up on Carter's looking at the police and what's going on. I think I'd like to know what's going on with that. I have very mixed feelings about it. And did I have one more thing? Oh, the marijuana, I don't know. I have to say I've been smelling marijuana every time I go outside for the last 10 years. So I'm not clear that it's much worse. There is certainly many more people selling it before. I mean, I assume at some point they'll crack down on people selling it, not paying tax and not having a license. Right now, it's like, I don't know, it's like everyone's dream world in 1965. You can go to Washington Square Park and get whatever you want. But yeah, as I said, maybe there's a little more, but it's been pretty bad around here for a long time. So
Yeah,
I'm not clear.
You should know that the question of unpermitted marijuana sellers, retailers, which seem to be abundant now, is a subject that's come up. We've asked a lot of Mark Fitzgerald, who runs our cannabis licensing committee, about it. And our understanding about it is that as more legal entities come online, there's going to be stronger crackdown on those that are illegal.
That's what I guess. But
Which
yeah.
is amazing to me, because I look at these stores. I mean, there was a landlord, selling the store. There's someone signing a lease. There's someone tricking the whole place out, spending money on it, buying stock, all of it. I mean, unpermitted, so. Wait, what was I going to say about harm reduction or weed? I don't know. The smell of weed, it's like the smell of a bus going by. It's like, what am I going to do? It's like, poop, on the other hand, that's a different thing. We're still waiting for Kelsey.
Suzanne, I can't raise my hand, but can I add one other thing?
Of course, please, Will.
I'd just be curious to dig, maybe there's not much to dig into, but I think I was reading about our new Congressman, Dan Goldman, was working on something to sort of close this issue with Medicare, Medicaid funding mental health institutions above a certain size or something like that. I remember talking about it in the past. Is that something we could just try to get more up to speed on, or maybe someone knows more about that?
That's a great idea, because I know nothing about that. And that's one of the reasons I want to connect with people at CB4 and CB5 who have mental health on the mind as well. I spoke to the Department of Health and Mental Hygiene about mental health, and what was pointed out to me was this mayor's plan, which is to have mandatory hospitalization. I think there's going to be a lot of legal challenges to that, but so that to me is kind of, for now, neither here nor there. My bigger concern is that even if you go voluntarily, I think there's a dearth of services. I just don't know that the infrastructure really exists to turn people's lives around.
Yeah, I just want to follow up on that, because I think right now we don't have enough services for people who want services, and to say you're going to put people in the hospital, what's going to happen is they'll be turned around and thrown out in 3 days. We don't have enough care. Let's expand the amount of care we have and then talk about whether it's voluntary or involuntary.
Exactly. That's why I think maybe closing solving this issue. And I don't know why that issue was created in the first place. I don't know the history, but that, getting some federal funding in, making larger institutions again more economically viable could be part of the solution.
Yeah, thanks. Well, you're going in and out a little bit, but I hear you. And actually, since I know diddly about Medicaid and Medicare, that's really a useful thing. yeah, I mean, my sense is that there was a really interesting piece in the city, the publication, The City, that I should share with you about a woman trying to keep her brother out of jail, who he is schizophrenic, and all the hoops that she's had to try to jump through to have that happen. And this organization, Cases, was cited in that article, which is why I went to them. And it's like the Center for Alternative Sentencing, something or other. And one of the things that they do is they provide mobile mental health treatment so that they go to where people are and keep them on their meds, keep them out of hospitalization, and keep them out of jail, keep them out of going back to prison. Sorry, I didn't realize you were waiting for him. Sorry, yeah, I am waiting for him. What did you think?
It looks like.
Oh,
we-
here he is. Kelsey Louis is here. Wait, Kelsey Louis is here. Has he been elevated? Yes. I don't see. Hey, Kelsey, thank you so much for joining us. Let's see. Hi there. You can unmute yourself. You are unmuted.
Hello.
Hi, thank you so much for joining us. I'm sorry that that you had to feel rushed.
Oh, no worries at all.
Is there anyone else attending from the door? Because there are some names on our list of attendees that I don't recognize, and I don't know if any of them are staff members.
No, it's just me attending.
Okay, great. Thank you so much for joining us tonight. Can you please just introduce yourself, and we'll start with that?
Sure. Hi, everybody. Sorry for running late. I am Kelsey Louis. I am the CEO of The Door and Broome Street Academy.
Great. I just want to do a quick introductions to you. I'm Susanna Aaron. I'm the chair. We've met before. I'm sure you can see the square. John DeVerna is on our committee. Ivy Kwan Arce is on our committee. Ryder Wave on our committee. Wayne there just popped up on our committee. William Benish in the dark because he's traveling. And Rachel Yarmolinsky is our public member. And we are also joined by Janine Kiley, who is the chair of CB2, and two members of CB2 who are not on our committee, but are very active CB2 members, Carter Booth and Donna Raftery, and also our brand new district manager, Mark Diller. So thank you so much. The reason I was hoping that you would join us. I mean, it's been a while since we met with you. I think we met with you the first time you were like 6 months into the job.
I think earlier, yeah. Yeah, it's brand new.
And I know that, and we like to be able to cite The Door in our annual district statement of needs, which really calls for us knowing what's going on with you guys and what new programs you might need funding for, what capital projects you might need funding for, and what trends you're seeing. So I'm just hoping that you can bring us a little bit up to speed on that.
Sure. I just also, I mean, am I interrupting anything? You can finish whatever business you were doing.
No, we were filling the time before
Oh.
you arrived by just talking about subjects that might be interesting for our committee to address in the future. But you are the star, so go for it.
What version do you want? I have anything from the 3-minute version to the 4-hour version.
Well, I think that I think it's fair to say that people are familiar with The Door in general. And what I think would be helpful, you don't have to give us the elevator pitch to brand new people. We're familiar with you, but it would be helpful to know, for example, trends that you've seen over the last couple of years or since you joined. I know also that you guys have had some issues. You've had some scandal, hot water issues, and you've had to address those. So just bring us up to speed on what's been going on in your tenure.
Sure. Okay. Happy to do so. Again, thanks for having me. So let's see, just to answer some of your questions directly first. In terms of some of the trends that we're seeing with our young people, what we're seeing is we started in-person school. So, we have The Door, which is a youth development organization, as well as a charter high school. And we are, what we've seen with our young people is one, increased need for mental health services. In some ways, we're seeing young people who are requesting mental health services, and that gives us a little hope that perhaps the stigma around mental health with young people is not as strong as it is with our generations. However, we are concerned that there is that level of need, and that also means that there are people who require mental health services that aren't raising their hand saying, I would like mental health services. Our mental health services, our numbers have increased in the school threefold, and in other places, maybe it's increased, it's doubled.
Now, when you say mental health, I mean, we were just having a conversation about people that we see on the street who appear to be in dire need of severe mental health services. Is that the kind of crisis that you're seeing, or are you seeing more issues that would lend itself more to, I don't know, depression or talk therapy or just sort of coping with life?
Yeah. I mean, the first answer is everything, but in particular, the impact of trauma. So loss, trauma, anxiety, and depression are probably in that order. But also, we're also seeing the impact of isolation and a lack of social skills development. So in our school, when we first resumed in-person school, we saw a frequent number of either fights or altercations among young people, and a workforce that was exhausted and perhaps not as prepared to handle these issues. So I think, so both of those things combined made for just some difficulty. We have seen, we've also seen a constant flow of young people who are needing support with work. And we attribute that to a number of young people just needing to support their families. And we also saw a similar trend in our food pantry program. We had a small food pantry program during the pandemic. It increased, and what we learned is that a lot of our young people were also supporting their families. So they were asking not just for food for themselves, but also multiple meals so that they could feed their siblings and or their parents. And that also impacted school attendance. So we would often find that people in our high school who also had younger siblings often had absences in relation to things related to their younger siblings. Let's say if their school closed, or if someone had to go to a doctor or something. And so the burden on our young people had increased because of the pandemic. So those are the trends that we're seeing. Outside of the pandemic, we're also seeing, kind of, as you all are probably very aware, is the increased need for immigration work. Our legal team, we have 25 lawyers and additional 20 staff members who support legal. So we're basically a mid-sized law firm that does 95% of our work is with immigration. And those numbers have been increasing for the last 4 years. And with the asylum, with the asylum seekers who've been dropped off bus to New York City, we've been part of that work as well.
That work has really increased in the last year, right?
Yeah, that in particular, the last few months. Yeah.
So these issues, how do they tap into your resources? Like, how do they affect, your budget and your staffing and your operations?
And what it does is it increases the workload for our existing staff. And so the demand has been great. And in some areas, we've been fortunate to be able to work with our funders and donors to stretch that. In some cases, we reprioritized. We've shifted monies that could be shifted. So let's say a donor who gave us a certain amount of money for general operating support. When we thought we were going to do this, now we're doing this. And this is mental health work. So, and some of our foundations who've asked us what our priorities are, we've said mental health. So for example, we partner with Trinity Church Wall Street, who had given us some funds for some of our runaway and homeless youth work. They gave us an extra new grant to help with the asylum seekers, knowing what we are capable of doing. Since our services are so comprehensive, they wanted to support this issue, and so did we. So we asked them, and they gave us. We wouldn't have been able to do so, or it increased our capacity to do so.
Right. So what portion of your budget is city contract? Like, what are your funding sources? How does that, how much of your funding is donors? How
Sure.
much of grants from not-for-profit foundation?
So the school is $8 million, and about 90% of that is state funding on a per pupil rate. The rest is private. On the door side, that $32 million or so, I would say about 3 million, about 10% is Medicaid funding from our health center. 25% is from donations, either from individuals, corporations, or foundations.
Wow, that's much higher than I thought it was.
And that leaves 60 to 65% of government funding. And that government funding is split mostly, I would say, 80% city, 15% state, 5% federal. And an organization like Vera Institute, we count as federal. There's some quasi-federal funding, but that's roughly the breakdown. And UICD is our largest city funder.
I'm going to just take the floor with 2 more questions before I open it up to everybody, but selfishly. Do you guys have any capital needs coming up in the next year?
Yes, absolutely.
Can you share those with us? Oh, and I have another question too. And also, are you doing still the outreach? You used to have an outreach program on the pier that was funded with discretionary funds from the city council. So I'd like to know if that's still happening, because we supported that in our district needs statement. I don't even know if you still do that. And then the other question was, your capital needs.
Sure. So we don't do that any longer. We do have outreach, but not necessarily. It's undefined where we can do it. In terms of our capital needs, we have many, and this actually answers kind of one of our new programs. One capital need is that we recently applied for an Article 31 mental health license that will allow us to expand in terms of scope and volume our mental health work. We currently have an Article 28 medical license, which allows us to do 30% of our visits as mental health. However, it's capped at 30%. With this state, with the Office of Mental Health funding or licensure for an Article 31 mental health clinic, we'll be able to expand that. And we passed, I'm not sure if that's where we got approved for round 1, which is the programmatic design. Round 2 is approval of our space. And they have, and this is actually the more strict part of it. There are very strict requirements around our space, partly for size of office, partly for confidentiality and flow. And so we will have to do some construction in order to meet those requirements. That's one capital need. 2, we have to repair our facade. And the longer we wait, the more expensive it's going to be. However, we applied to the city a while ago, and our building, we have the basement to the 5th floor. However, there's a foundation, Paradnik Foundation, that owns part of the 5th floor, and the fund for the city of New York is on the 6th floor. Because of those 2 other tenants, we couldn't qualify for city funding for capital needs for the facade building, because it would have benefited them as well. But that is a need that we have, that again, the longer we wait, the more expensive it gets. And then there are just smaller capital needs around improvements. Our piping, our plumbing rather, our bathrooms just need to be updated. And our light fixtures could be updated too.
And do you guys do you put in any of those requests into participatory budgeting?
We have in the past. I don't know that we have recently, but we have in the past. We've been looking at, we haven't been successful with city funding for this. So we've turned to our private partners. We got a small grant to help with our lighting, but we didn't get the big one to work with our other capital needs that I mentioned.
And you guys, I mean, do you receive discretionary funds from?
Oh, yeah, we absolutely do. We receive maybe just under $1 million in different pockets for a variety of programs.
I'm gonna, I mean, anyone on our committee, feel free to raise your hand. I have another question that I'll ask while I wait for you guys to raise your hand. It's a bit of a change in subject. I know that there was a lawsuit, a fine, an issue with the door. I think it was to settle matters that preceded your tenure. I
Yes.
just wonder if you could, but it had to be, can you please share that with us and where that stands and what that was?
So it's over. So
Fun for you.
yeah, welcome. So in between 2008 and 2015, the door through its health center over-reported, so filed incorrect numbers related to the number of visits. So in the health center, there is, the Medicaid billing is complex, and and it has many rules. One of the rules is that the way you need to count visits is what's called threshold visits, which is the number of times someone walks through the threshold of your door, no pun intended, rather than the number of visits they receive, the number of services they receive. So for example, if a young person came to our health services and got an eye exam, a physical, and a therapy session,
that's one threshold.
That should count as one. Between 2008 and 2016, the door counted that as 3. And so in this particular pool of funding called the Indigent Care Pool, that's where they pulled the money from, or that's where we filed the report to be reimbursed. And so between that period, the door filed their reports counting the number of services rather than the number of threshold visits.
I see.
And so that yield, the total number was this. Had we billed properly, we would have gotten this. And so that was the difference of the penalty. And the penalty with the U.S. Attorney General's office, the penalty goes anywhere from 1.5 to 3.3 times the amount. And because of our cooperation, so as soon as we heard the organization cooperated, we agreed up front that we would remit payment, and we complied with everything. And we paid just under 13 million, 12.9 million, which represented about $8 million in overbilling, and then a 1.5 multiplier. And so
was that a tough year for you guys financially? Did you have a receipt for it?
Here's, so what I would say is the board, so we complied, and we got through this, and we agreed to make the payment. We paid right away, and it was thank you for these notes. It was split between the state and federal, but a total of 12.9. And the
board helped you out to cover that.
Yeah, we were told that we only received a 1.5 multiplier because of our cooperation. And so years ago, our board did, as you may know, sold the air rights to our building and invested the money wisely. And so we were able to cover all of the legal expenses.
Wow.
And the 12.9 million with our reserves without impacting our day-to-day operations. Obviously, it impacts a lot of other things in terms of our
your reserves.
To the tune of 13 million plus a tremendous amount of legal fees. And so, I'll share with you that it absolutely changes things for the organization. But it doesn't change our day-to-day operations and of course, our commitment to serving young people. We didn't make any cuts because of it, and we didn't change any of our services. So we say that to our funding partners so that they can remain confident in our ability to use their money wisely. And we've also made clear to our partners that none of the monies used to pay back none of the monies used to pay these fines were any of our funder money. This was all investments and reserves. The other thing I think that is important to note that since then, so how will we make sure that this isn't happening again?
That was going to be my next question.
And also to be clear, I knew about this during my interview process, and I still took the job. Partly because I know Medicaid billing is complicated, and I understood from the very beginning that the door was cooperating, and I knew about the reserves. I had no idea how much we would end up having to, what the fines would be, and so here are some important facts in terms of giving our partners confidence. One, there's new management. These misfilings happened at a time when there was a different corporate structure. Some of you may know that the door was a subsidiary of University Settlement during that time, and we are no longer. We used to be partnered, where we shared back offices, and I think so. We shared IT, facilities, finance, development, HR, and during that, while there are many benefits to that partnership, one of the things that one of the downsides was there was a dilution of administrative oversight that would allow something like this to happen. So one, the corporate structure of the door is different as of July 1, 2021, when I first started.
Congratulations.
So thank you. The corporate structure is different. Two, there's new management. And this happened not even during my predecessor's time, but 2 CEO generations ago, 2 CFO generations ago. And so everyone involved in the filing is no longer employed at the door. And those people who submitted the reports improperly and incorrectly were never door employees. And so, and on top of that, I recently hired a chief compliance and operating officer. We've also outsourced our finance, and going forward, and we changed our auditors because one could argue that our auditors should have caught this. And so we've changed our auditors, and we will change our auditors every few years, which is best practice for a nonprofit. And we have hired a law firm to help us strengthen our compliance program. And I think part of the reason I was hired was because of my extensive background in healthcare and Medicaid billing. So with all that, we don't expect something like this to happen again. There's no reason why it should happen again. Oh, and one more thing, that report that got filed where all of the errors happened are now being validated by an outside, a different outside accounting firm, not even our auditors. So there's now 2 levels of review.
Thank you. Thank you. I'm sure that was a very difficult time for you. And I'm sure you've had to give this spiel to other people before. So thank you very much for sharing it with us.
Sure.
I saw in the chat, there's a question of who purchased your air rights. I think it's the building just west of you, right?
Yeah, I don't, it's their holding company. I can find out, but I just
no,
don't.
I mean, whatever, but it's that building. If you're
Yeah.
coming up Hudson Street, it was under construction for a long time, and it's right to the west of you. Did anyone any of our attendees want to ask any questions? Anyone, please feel free to raise your hands. We're a small group. Yes, I see Ryder.
Yeah, maybe this is needless to ask because it sounds like this issue was handled very well and that it's kind of the best case scenario for something of this magnitude. But I guess the question I was thinking about before you talked about all the great, the new auditors, the 2 generations ago, et cetera, et cetera, et cetera. Do you think, is there any adverse impact on the confidence of the funders that are supporting the door now? And is there any impact on the long-term solvency of maybe folks who have been very excited to support at the door might be a little bit antsier than they would have been had this not happened.
Yeah, it's hard to tell what people are really thinking, but of course I had to go on this campaign of calling all of our partners to make sure that they knew. And I didn't call every single donor. I mean, I stopped after a certain dollar amount, but every single person who I spoke to kind of pledged their commitment to the door. Some were quite angry that the state was going after this money because, by the way, just it may not need to be said, but all of that excess money went right back into providing services. Nobody benefited personally. And so some, I would say, of all of our partners, some had more questions than others. Some of those questions were more pointed than others, but with all of the fact patterns in terms of none of their money went, none of their money went to this, and all the things that we're putting into place, and that I'm new. Everybody kind of pledged their partnership and commitment to the door, and we're quite pleased with how we handled it. And so I will say there was one, which probably should remain confidential, but one compliance issue where the compliance program for the corporation could not fund us. The person who we work with said, I wish I could, but it was a systematic that we just got disqualified automatically. And of course, we don't know the impact of any new donors who would have come. And, we don't know that, people don't donate for lots of reasons, and we don't know if this will be one of them. So,
well, kudos to you for handling what I'm sure was a very hard way to start at an organization. I wanted to ask you just a little bit about your mental health capacity and
my mental health capacity.
I wanted, when you say that you're applying for an Article 31, I think is the number, and you want to expand your mental health capacity, what numbers are we talking about? How many people do you serve now? How many people are you hoping to serve? Or is it a question of the same number of clients, more hours per week? Is it, what is the difference in capacity that you're able?
So it's all of that. So currently in our mental health clinic, we have about, it's probably easier to do this by visits, but we have about 3,000 visits a year, with 30% being a cap of roughly about 1,000 visits, mental health visits. Now, depending on the nature there, some people come in for 1 or 2 sessions, some people come every week for, more than a year. So there's no, an average number wouldn't really be helpful.
Right, of course.
But we see roughly, through that program, we roughly see about 250 people, roughly. And however, there are additional mental health programs. So when we talk about mental health, we talk about everything from psychiatric care to medication management, to kind of therapy 45 minutes a week, to crisis intervention, to what we call community mental health. So someone might be having a bad day and may need some time with a counselor to speak with, or a support group. And many of our groups, like we have something that we call Dorigami, which is basically people come to do origami, and in those sessions we talk. Even our music program, our music teachers will have jam sessions with young people, and it's not just music, it's often
the jam and bull session.
Exactly. So our numbers will say 250 people roughly are seeing about 1,000 visits per year. However, there's more than that, and what happens is that other stuff is not reimbursed, and so when I talk about the fact that the Article 31 license will allow us to expand our breadth and our volume and our breadth, we will be able to bill for some of these mental health groups and crisis intervention And so we'll be able to bill for more services. So hopefully it'll be self-sustaining, then we can grow what we are able to offer.
Do you guys have a difficulty with the city and retroactive contracts? This was an issue that a number of years ago, the city's controller brought up, which is that the city takes so long to reimburse people. I mean, you're a pretty big organization, so I'm going to guess you can float that advance.
Yeah. Yeah, I mean, I've dealt with this, and even at the other organizations that I've worked at, it's constant, and it's constant and not consistent. So it's not like they're always 90 days behind, which gets difficult, right? I mean, if we knew that they were, let's say, always 90 days behind, then that'd almost be easier to plan. And so it has been difficult. Fortunately for the door, because of our diversified funding portfolio, donors, Medicaid billing, and government funding, and even government funding is scattered. We are able to, we're able, and our reserves, we are able to withstand some cash flow difficulties. It's not great for us, but we're able to.
Well, yes, I don't think it's great for anybody. Wayne?
Hi, yeah, Kelsey, I just want to ask you sort of overall about your numbers. Are they going up? Are they steady? And the mental health services, do you have enough services to support the young people who need them, or do you need extra services for that?
Yeah. Prior to the pandemic, the door would see up to 11,000 young people each year. In the past 2 years, that number has been close to 7,500.
Wow.
And across the board, the numbers have dipped, but where it dipped the most is in our meals program. And where it's risen is legal. As I mentioned, it has grown over the years, and our mental health. But everywhere else, it's dipped. While remote services, and we do still offer some remote services, has allowed us to reach some people who may not have been able to, by and large, our numbers have dipped because our model has been an in-person model, and we grow because of word of mouth. So, and we have something that we call Center Space. Center Space is basically our marketing and engagement tool, because you can become a member of the door without necessarily signing up for a mental health service or any formal service. You can come to the door, come to Center Space, come to the door and spend time in Center Space to be with your friends for social time, and maybe get a meal. In terms of our capacity, we were creative and got a number of social work interns to help with our capacity, both at the school and at the door. And so while we could always use more, we were able to actually shrink our waiting list. And so I don't know what it currently is, but our waiting list is not a problem anymore.
Your mental health waiting list.
Yeah, correct.
You used to have a mental health waiting list and now you don't.
Correct. Or it's not as big of a problem anymore.
You have it, but okay. I just want to introduce Keen Berger, who's also a member of our committee who just joined.
Hello.
Other questions? Gosh, I could ask so many things. It's interesting because you just said that most of your clientele has dipped, but earlier you said that the need for your pantry services has increased. That just increased sort of in the context of a dip, or has it increased overall?
So the number of discrete young people who come to our organization has dipped. However, the demand for certain services has increased: legal, food pantry, and mental health.
And mental health. That's very interesting. I have another really off the wall question. Because you also provide sexual health, right? Are people talking about abortion? Are people afraid of abortion going away? Is that an issue? Does anyone care about it?
Oh yeah, absolutely. Many of our staff are concerned, and so we do a lot. A lot of our work is also centered around making sure that our staff feel informed and taken care of. And I think more and more organizations need to think about the workforce. I think that is becoming increasingly more and more challenging. And our young people, we had to do a campaign around education around what the Roe v. Wade decision actually meant, and what it means and what it didn't mean.
Right.
And I think someone just posted
Abortion is
that
legal.
abortion is legal.
Right.
And well, we needed to make sure that people understood that. Like, that was a piece of education that young people needed to have. We have always done options counseling, and we the new CEO of Planned Parenthood of Greater New York, Wendy Stark, who is the former CEO of Fallon Lord, I was the former CEO of GMHC, so we're very close friends. And so that we have access to additional services that we don't provide, but it was a concern, and also it just for some of our young people, it was also just even if they weren't even thinking about abortion, but just the idea that the federal government was taking away their rights was just a scary thing for some people. And what did it mean for, a lot of the talk has been, what does it mean? What was next? Especially LGBTQ young people. That was a concern. And of course, if you're a trans person or young person, you live in fear all the time around decisions like this. So
what about your runaway and homeless youth? Is that what kind of how much do they constitute your clientele? Do you see that trend increasing? I know that it's nice. Sorry, my English, I'm bumbling. A long time ago, it was very, very dangerous to be trans or gay. We hope that has gotten a lot easier for a lot of people. We know that fueled a lot of runaway teens in the past. I'm just wondering what you see in terms of trends these days.
Yeah, so there are multiple questions. I hope I answer all of them.
I know I haven't really been specific. I'm just interested in knowing runaway and homeless youth, which is an area of your service.
Yeah. So we are what's called New York City's designated center for runaway and homeless youth, which means that if the EMT or police comes across a young person, they will bring them to the door, and we offer them, we have laundry facilities, shower facilities, food pantry, and a dinner at 4:30, and a place to rest. And we do crisis intervention. We try to get to the underlying, we try to understand, are they homeless temporarily or permanently? And then we try to connect them to either shelters or housing. We have 99 beds of supportive housing in the Lower East Side. And so those numbers have actually kind of remained steady, and we don't know what that means, but it's kind of remained steady. We roughly about 600 to 800 young people each year. Discrete people, which is about less than 10, depending on where our numbers are, but a little less than 10%.
And anyone who comes to you, though, is coming before 5 p.m. Your doors close at a certain time.
So pre-pandemic, we closed at 8. Now we close at 6, and so we are looking at, our young people are slowly coming back. Our numbers per day are coming back, are increasing, even though our total number for the year has not been increasing back to 11,000 yet. But more and more people are coming in person more often.
And I'm going to guess that you're not the only place that is an official receiver of homeless use. A Covenant House, I'm guessing, is another one. And
right.
You're a wealth of information, and I hope that this isn't annoying to you.
No, I love talking about the door.
We didn't ask for a formal presentation, but we sure are asking a lot of questions. Ryder looks like he has another question.
Yeah, and I want to promise that this will be my last one, but maybe that's premature. And I think I actually asked this exact question the first time you were here, which is, what kind of coordination, if any, do you do with other service providers geographically and kind of programmatically aligned? Like, you know, I've been a youth mentor at the LGBT Center here on 13th Street. I imagine a lot of the same population is going there, also needing mental health services. How much is there like
Right, interflow.
coordination so that it's either, you know, who's been seeking help elsewhere, or that there is some sort of kind of synergistic support, or just sharing information?
Yeah. So what I found at the door, and I think this happens at many organizations, is they will say such and such is a partner, and there's a piece of paper called an MOU that both CEOs have signed, and they say that they refer people. And then when you apply for funding, you say, look at all the partnerships we have. I'll tell you that happens at every organization.
Right.
And that happens at the door. Of course, we have our partners. But I have been really interested in trying to build partnerships, especially having been in the HIV world for 14 years. And then coming into the youth development world, I needed to kind of intentionally make partners and find partners. And so I am really looking at ways to develop true partnerships. It gets tricky.
What does that mean, a true partnership?
So places, you know, so true partnership where you can call and say, hey, we have a young person who we can't serve, or for some reason it's not working here, or they want a Spanish speaking this, or somebody who knows this, or in the Queens or somewhere else, and say, can we send them to you? Part of the difficulty is, and so we're slowly forming them, and, you know, it's interesting because of the door, we can find partners. You know, our typical partner is a youth organization. So 2 classes, a youth organization that doesn't do everything we do. So they might do one thing, but they find that their young people also needs that, or an organization that does something that doesn't have a specialty with young people. So now, of course, as you can imagine, I have developed partnerships with people that I know first, right? So GMHC. So we serve people ages 12 to 24, and I know that GMHC does not have a health clinic. So while we both do HIV testing and we both do PrEP navigation, I've asked for them if we could develop a true partnership where they send their young people under 24 to our health center. And vice versa, if we need, you know, so we've sent multiple people over who either wanted an LGBTQ therapist, or someone who was recently diagnosed with HIV, who wanted a therapist who was well versed in dealing with people who are newly diagnosed. So that to me is a true partnership, when there's an understanding of what the needs are, and a true, like, despite funding, and yes, the person will no longer come to our therapy, but they're better off at yours, we will sacrifice and give up, because nonprofits are forced to compete. You know, our funders are asking us about numbers, and we never want to give up we never want to give up.
Oh, that's interesting.
And so, you know, for example, we invited Wendy Stark, the head of Planned Parenthood, to speak at an event in front of our major donors. And we thought, why would anybody invite another nonprofit leader to come into an intimate room with other donors? Because we feel that, Wendy and I both feel that if the pie can get bigger, and
Right.
people can donate to the door and to Planned Parenthood. Would I do that with another youth organization down the block? I'm not sure, but I think this is how nonprofit leaders need to start thinking. And so I'm trying. So we are continuing to develop more and more. We're working with Covenant House because, again, they were over capacity. We're working with schools. We're working with another charter school who has this particular program where they have AmeriCorps programs who can serve as tutors. So rather than finding tutors at a for-profit company, we are paying this other charter school system to come, and they provide tutors for us.
Got it.
So there are partnerships like that as well.
And if you don't have that partnership and you can't serve a kid, I mean, do you just call up another organization and hope that they can take them? I mean, is that?
Yeah. But to say, hey, this is so-and-so from the door, I know you have called you 4 times already. We have one more.
Got it.
Yeah.
Keen has a question.
Maybe you've already answered this, but The migrants who are being bused in, are you serving them? Is that part of, have you already answered that?
Yeah, I answered it, but I'm happy to answer again. So Covenant House, I think because of where they are, because of one of their offices near Port Authority, and I think what happened was their address showed up somewhere. So that's been everywhere they've been dropped off. They reached out to us because they know the breadth of services that we offer. And so we started to work with them, but we were starting to get overloaded. And so we asked one of our partners to help support us, and they gave us a grant to hire someone to work specifically to help triage and coordinate some of these services.
Thank you.
You're welcome.
Ivy?
So in the same theme of the immigrants, did you have to scale up with like specific people that could help them with immigration and with sexual health? And what happens when they're transitioned through different types of housing? How do you follow them?
Yeah, so when people are transient or homeless and sometimes they're hard to keep track of, we have to rely on them to come back to us. And so sometimes, we have outreach workers who are able to go out and, our team, young people are good with technology and are actually pretty good at staying in touch. And so, and also we often are able, in many cases, there's often a network. So like there'll be a few people go to that school or a few people who live in that community. And so we're able to kind of say, they kind of travel in packs sometimes. We do, unfortunately, every so often have someone come to a service and then they never come back and we can't get a hold of them. In terms of your first question around, was it about what services we provide to the immigrants?
Well, it's about like sexual health and, because like culturally sexual health is a very difficult, like even if you want to do testing, how do you address that and how do you follow up with that? And also I wanted to know if you are thinking in terms of having like maybe this first wave of immigrants come to your service, the ambassadors for your next, very soon future to help you bridge those cultural and, things.
Yeah, I didn't think of that, but now that will be a plan. Thank you. I think that's a brilliant idea. And it's funny because we do that with our school, right? We have students, upperclassmen who help give tours to potential ninth graders. And so I think that's a brilliant idea because this issue around being culturally humble and providing competent care is important. And it's actually at the door, it's actually kind of quite unique. All of our attorneys are at least bilingual because we do most 95% work with immigration. Not all are at least bilingual. And so what happens is we often find, and so that isn't the case with all of our other departments. And so what ends up happening is a lot of our immigrant clients aren't able to access freely all of our other services. And it often takes one of our lawyers to help
walk over.
Yes. And so we are kind of, we're always thinking about culturally more competent care. And so we did that with our trans health services. We wanted to make sure that we were doing all the things we needed to do to strengthen our trans health services. And, we call that trying to be more culturally humble / competent. We also think about how certain communities have developed a mistrust of the healthcare system, and we've been trying to flip the narrative. Not why do some communities not trust the healthcare system, but what has the healthcare system done to certain communities to engender that mistrust? And what we do there is, so we don't do this. We have a youth council, which is basically young people who kind of like a consumer advisory board, and we also have a segment of them who are peer health educators,
Mm.
who, we as adults can talk to young people till we're blue in the face that they should do certain things about their health. Have another young person tell them, it's gold. And I don't know that we necessarily think about that along race. We do that around young people, and of course, our young people are diverse. But that's something I will absolutely look into. But I would say my guess is that they are thinking about diversity among race. But also, I think that's something that I think is so hard to achieve, and we absolutely need to think about that.
I don't have any more questions, and I'm not seeing any more questions. If there aren't more questions, I'd like 5 minutes to meet as a committee before we adjourn, and I will say goodnight to Kelsey. With gratitude for coming to see us.
You're very welcome. And like I said, I love talking about the door. And I will tell you, I'm not surprised, Ivy, that you had a question that will make me think and add to what we offer. So thank you all. And anytime I can help, let me know.
All right, thank you. And thank you to our attendees as well. Good night, Kelsey. Our
Bye-bye.
committee is sticking around. If the attendees would like to stick around, that's fine too, but we won't be entertaining any more comments. I wanted just to meet with you guys to understand if you felt we needed a resolution out of this meeting. My inclination is to say no, but that when September rolls around, we put in our budget requests some capital money for the expansion of their mental health facilities. But that's something we could also put into a resolution now. I just wanted to know what you all think.
I think it sounds like the most proximate need for them is getting this Article 31 approval or whatever. And since that's not really something in our ambit to advocate for, I don't think we need to be saying anything right now on their behalf. So I agree with you.
Although now I'm changing my mind. Ivy, what do you think?
Well, I'm still navigating how resolutions are made. The whole budget thing, obviously, I don't know if that needs to be done now and re-echo later on at the end of the year. Maybe that's helpful.
I'm starting
just
to
for
think
members
that if we have a resolution that we pass now that supports that, then we can use that as a basis to support it when I see Keen lifting her thumb. Yeah. So, I mean, we're not asking for specific funding. We're not asking for even more money. We're just saying that we support an expansion of their services.
Exactly. I think it just politically, in terms of what happens with our resolutions, this brings it to the attention of the wider community, which is always a good thing.
Right. And you know that I don't like to take positions on budgets because budgets are zero-sum games, but we would just be saying that we support an expansion of services.
Yes.
Not to say over anything else, but just we support that. Wayne?
Yeah, I was just going to agree and say a resolution supporting their Article 31 would be a nice thing.
Okay, great. So I will write that, and I may ask Wayne if you understand an Article 31 better than I do, so I may reach out to you for some guidance on writing that resolution, and I'll send it to you. I'm assuming. Well, let me ask you, what would your vote be if we write a resolution in support of funding for the expansion of the mental health services of the door? Can I get a show of hands of who supports that? Okay, so that's unanimous. All right, then thank you very much. And we'll take care of it that way. And then, I'm thinking of something else, which is we've been talking a lot on the community board, especially because of term limits, that there really should be more spreading of responsibilities so that we have a stronger pipeline. So I won't do it this month, but I'd like to ask in the future. I may ask volunteers to write resolutions or reports. Janine also said, and take notes during the meeting, but for now, I just rely on the transcript, which is so freaking great that I don't have to take notes. So as long as until we for as long as we have a transcript, that will be easy. So we'll do that for February then. I don't yet know what our topic will be. I really want to do something on mental health, but it's just kind of in its nascent ages. Oh, no, wait, there is something we may be. I'm hoping that in February, the Department of Social Services will be available so that we can do a meeting on the use of the hotel at 231 Grand Street for asylum seeking families. And I'll let you know. Anything else?
Well, I just wanted to say, I'm sorry I was so late, but I'm on the search committee of Judson Memorial Church and we were interviewing. Did you already say that?
No, I know, I knew that you were going to be late because you told me that.
I mean, we're going to get a great new pastor in a month or two. We've been with an old pastor, but you know, Judson is a social service group as well as everything else.
Thank
So,
goodness. Churches often are, which is nice.
right.
Terrific. Say good night.
Thank you.
Good night, guys. Have a lovely week. Thank you. Bye-bye.